Hi, I'm Brent Stafford, and welcome to another RegWatch segment on GFN.TV. And I'm joined here today with Dr. John Oyston, a Canadian anesthesiologist. Hi, Dr. Oyston.
Hi.
So for our audience out there globally on GFN TV, who are you and why are you so passionate about tobacco harm reduction?
So I'm now retired, but I spent 40 years working in the operating room. And I worked in a hospital that dealt with vascular surgery, dealt with cancer surgery. So I spent way too much of my life in the operating room dealing with people who smoke cigarettes, who are now suffering as a result. And so I've been there while my surgical colleagues have removed a lung or part of a lung, they've amputated a foot or a leg. And these are horrible operations. They're disfiguring, disabling, painful procedures. And it just appalls me that the reason why we're having to do these operations is that these people started smoking as teenagers, and they probably tried to quit when they were 30 or 40 or 50, but they weren't able to. And because they weren't able to quit before cigarette smoke did permanent damage to their bodies, they've now ended up in the operating room, and I'm caring for them while they're having these procedures done. And in all too many cases, because they're so dependent upon nicotine, they're going to continue to smoke, and they're going to continue to come back for repeat procedures. So it just seems to me incredibly wrong that, 2 generations after we realized how harmful cigarettes are, there's still, 8 million people in the world who die from, 8 million people who die from cigarette smoking every year. And we're really not doing enough about this. In Western countries, we have a whole pile of somewhat half-hearted initiatives which are slowly cutting the cigarette smoking rates. But meanwhile, in developing countries, people, as soon as they have enough money to buy their food and shelter, are then buying cigarettes. So overall, the number of cigarette smokers in the world is still going up. So I've always thought this was appalling, and I've always thought, well, what can I do about it? So the first project I did was a thing called Stop Smoking for Safer Surgery, because that was sort of in my wheelhouse. And that's just very interesting, because if you can get people to stop smoking maybe 4 to 6 weeks before elective surgery, you can actually halve the risk of post-operative complications. Quitting smoking before surgery decreases the risk of ICU admission, it decreases the risk of post-operative pneumonia, and also it decreases the risk of wound infections. So it's a very important thing to do. And I campaigned for this for several years. The Canadian Anesthesiologist Society and the Ontario Medical Association supported me for this. And this has now become standard of practice, particularly for elective joint replacement surgery, because most people wait for several months before they get their hip or their knee replaced. And this was last time for them to quit smoking before they come for their surgery. And this then reduces their risk of post-operative complications. So I then started looking at other things to do. And eventually I came across vaping. And I thought, this just makes so much sense, because there's 2 things about smoking. One is the nicotine that people are dependent upon. That's the things that gives them the cravings when they try to quit. And the other is just the habit of smoking. It's the having something to do with your hands, having something to put in your mouth, having some smoke to blow out or some vapor to blow out. And it seemed to me straight off the bat that this was such a logical way to deal with cigarette smokers, that it would be a way that they could have the nicotine that they're dependent upon, but without the 7,000 or 8,000 toxic chemicals that are present in cigarette smoke. And they can maintain most of the ritual that they're used to. They can continue to have something to fiddle with, have something to put in their mouth, have some cloud or something to blow around. So I figured almost immediately that this is something that was going to be big and was going to work. And then the research came along, and people said, well, this is 20 times safer than cigarette smoking. This is almost twice as effective as nicotine replacement therapy in a way of getting people to quit. In the UK, they're saying there's an extra 50,000 people every year who quit smoking, who wouldn't quit smoking without vaping. And so I've been a strong supporter of vaping, but unfortunately, many of my medical colleagues see only the dark side of vaping. They are overly concerned, to my mind, about the risks of vaping for teenagers. I think that is a problem, but it's a relatively small problem. And they're not using this new tool. And I just think it's appalling that physicians are so conservative about changing their practice. And the data is there, but somehow they're not taking it on board, and they're not using it as a way to change what they're doing.
Right. Now, one of the things that we know around the world is that physicians don't seem to have a proper understanding about the risk of vaping and the risk of nicotine in general.
Yeah, absolutely. And this is really appalling. There have been studies that say that 80% of physicians in the United States think that nicotine causes cancer, heart disease, COPD, and it doesn't, right? Nicotine is the stuff that makes cigarettes addictive, and it's not the stuff that kills people. And we've known that since the 1970s. People smoke for the nicotine and they die from the tar. But this isn't getting across to people. And if you don't know that, then you don't have the basic concept that if you could supply people with the nicotine, then they wouldn't crave cigarettes. And that's fine. And it's not for adults in particular. Using nicotine is close to harmless. It's certainly much less dangerous than using cannabis or using alcohol, which are accepted in society. So unless you understand the relative risks of nicotine and the other components of cigarettes and the relative risk of vaping compared to the relative risk of cigarette smoking, then you're kind of lost. You're not going to appreciate why vaping should be encouraged as a way to get people to quit smoking.
Dr. Oyston, to the extent that medical doctors are supposed to do no harm, is that the case then when it comes to vaping and some of the opposition?
I think it is true. I think that there are people who are so preoccupied by the issue of teen vaping that they will do anything that they can to try and scare teens out of vaping. And they'll tell lies about popcorn lung. They'll pretend that EVALI, which was caused by contaminated THC products and has nothing to do with legal vaping, they'll pretend that those cases of severe lung injury were caused by regular nicotine vaping. So people are prepared to tell a whole pile of lies in what I think they consider the good overall purpose of trying to scare teens against vaping. And whilst stopping teens vaping is a reasonable goal, first of all, it's better that you do that by actually explaining what the real risks are rather than inventing fanciful and exaggerated risks. And secondly, when you start doing that, and particularly if you start looking at things like flavor bans as a way to prevent teens from vaping, you have to look not only at the effect on teenagers, but you also have to have a look at the effect on adult smokers and adult vapors. And I think often what people are doing is scaring people so much about teen vaping that they are doing harm. And I guess the biggest example of that was the CDC. When at the fall of 2019, there was this outbreak of disease amongst young men, particularly in the States. They attributed this to vaping, and they started telling people not to vape. And they gave the idea that while cancer may kill you slowly in decades, vaping will kill you tomorrow. And we know from a pile of sources that this created so much anxiety that thousands of people who'd switched from smoking to vaping switched back to smoking. And so that absolutely was a case of people causing harm by scaring people out of vaping. One of my neighbors, his wife actually was vaping and started cigarette smoking after all the talk about EVALI. And I had a hard time persuading her to go back to vaping because from the media and from the CDC, which should know better, they were so scared.
And it's true that the EVALI scare had an impact on countries around the world, not just the US and Canada.
Absolutely.
Welcome to this webinar on the regulatory process, how vaping regulations are decided, drafted, and developed. So my name is Sonia Johnson. I'm the Director General of Health Canada's Tobacco Control Directorate.
Sure. Hello, everyone. Great to be with you today. My name is Laura Smith. I'm the Director of Tobacco and Vaping Policy.
So we know that there has been a rapid increase in youth vaping that we've seen not only in Canada, but that has also been seen in the United States. While we recognize that there's no single factor that has been responsible for driving that observed increase, there is research in this area that identifies the availability of a variety of desirable flavors as one of the key factors responsible for this increase. So with the proposed regulations for vaping flavors, that we just recently consulted on, it's expected to contribute to making these products less appealing to youth. At the same time, the proposed regulations would still maintain access to some flavor categories like tobacco, mint, and menthol.
Vaping is not harmless. While it has been with us for more than a decade, it's not a lot of time to generate the kind of evidence that would be needed to support a precise description of the relative risk. As well, the products have evolved and there is a lot of variation in the products and the way people use them. So vaping does have risks, and the potential long-term effects of vaping remain unknown.
So I wanted to be very clear here that there have been 0 deaths reported as a result of vaping-related illnesses in Canada. We're still learning more about how vaping affects health in general, and the potential long-term effects of vaping remain unknown and continue to be assessed.
How far have we gone over the precipice, or have things pulled back a little bit, considering that Health Canada did host that webinar late last year that did provide a little bit of hope?
I think there's a lot of stuff that's still up in the air. There are still a lot of legal cases that have to be decided. There's, I think, a challenge to the New Brunswick ban. And I think Health Canada may be beginning to see the light and beginning to see some of the pressure that vaping bans are just crazy and illogical. Okay, we're concerned about the number of teens who vape, although in fact it seems like the number of teens vaping in both Canada and the United States has probably peaked, and it's probably on the downswing now. But nevertheless, okay, it's a fair thing to be concerned about. So we have laws that say it's illegal to provide vaping products to kids who are under 18 federally, 19 in some provinces, 21 in PEI. So why don't we just enforce those laws? Why do we need to invent other laws when we already have a law to say effectively that teenage vaping is illegal? Nobody can sell or provide vape to teenagers. So let's enforce that rule. But for some reason, instead of doing that, they want to go this flavor ban route. Now, this is just completely crazy. So people say 90% of kids, or 95% or 98% of kids who vape use flavors. Yeah, that's pretty much true, in the same way that the vast majority of people who drink alcohol drink flavored alcohol, whether it's wine flavored alcohol or hop flavored alcohol or lemonade flavored alcohol. It's part of what makes alcohol attractive. When you say that 95% of kids vape with flavors, that doesn't mean that 95% of kids would stop vaping if flavors weren't available. And the flip side of it is you also have to look at what's happening to adult smokers. And the evidence here is quite clear that in the early days of vaping, and people who just transitioned from smoking to vaping, people tended to like tobacco flavors. They wanted something that was familiar. But then very quickly, smokers started to realize that the reason they were quitting smoking is they didn't like the taste and smell of tobacco. And so they wanted something different. And so even people who smoked and are switching to do vape are now much preferring dessert, fruit flavored, totally unrelated to tobacco flavors. And that's great, because once they get away from exposure to tobacco flavors, that actually makes them less likely to relapse to smoking. The sooner you get used to something that is, I don't know, mango strawberry or vanilla or whatever, the quicker you begin to hate tobacco, and you don't want to have that smell on your clothes, you don't want to have that smell in your house. So the flavors are an important part of helping adult smokers to switch to vaping. The idea that the only 2 flavors we're going to allow is menthol and tobacco is completely crazy. And I can't understand how anyone thinks otherwise.
And based on the actual language in the proposed regulations, Health Canada is adamant that those flavors that would be allowed must be disgusting. Basically, they can't be sweetened with any kind of sweetener. And the more disgusting, the better in their mind.
Yeah, exactly. I mean, I think somewhere in the bowels of Health Canada, there's somebody who thinks that enjoying vaping is morally wrong or ethically wrong or unacceptable, and that we can't allow people to actually enjoy vaping. Because that's the only explanation I can think of. They want to make vaping deliberately disgusting, and they're removing all sweetness. So, I mean, first of all, it's important to realize that tobacco-flavored vape doesn't actually contain tobacco, right? It only contains artificial flavors. And it needs a sweetness to create a tobacco flavor. And if you're going to ban the sweeteners, then I think it's 85% of all vape juice is going to have to be reformulated. And tobacco-flavored vape isn't really a very good substitute for tobacco to begin with. And it's going to be even worse if you take the sweeteners away. So it's crazy.
Well, let's dive into that just a hair more. Yeah. Somebody deep down in the bowels of Health Canada believes that vaping, enjoying the pleasure, the activity, is maybe immoral.
I think so. I mean, I think that's the only explanation I can find for the way that they're behaving. That they can't get the concept that we could actually have a medicine for smoking cessation, which is also actually enjoyable. And we've known that for a long time in medicine. Mary Poppins, a spoonful of sugar helps the medicine go down. Cough medicine has cherry flavor, which I personally hate. Throat lozenges are flavored with honey. So in medicine, we understand that sometimes to make a medicine acceptable and palatable, you have to give it an artificial flavor. That's logical. That's logical. And I don't know why we have a hard time accepting that the same thing applies to vaping. There's no conceivable way that what they're doing can end up being a public health benefit.
It very well could be a public health disaster.
Absolutely.
Health Canada may actually be not only feeling the pressure, but reacting to it.
It's so hard. Health Canada is a bit of a black box, but certainly you was talking about the webinar that Maria organized with some representatives from Health Canada. And they were certainly quite a lot on the defensive. They didn't say very much in the whole thing, partly because there are current legal processes that are underway, so perhaps they can't. But very much you got the idea that they were backpedaling and delaying, and they were saying that this isn't going to be something that's going to be happening early in the new year. So it gave the overall impression that they were beginning to have second thoughts about this.
If you were to be able to give some advice to some of our global tobacco harm reduction advocates that are watching this segment, what would that be?
Keep up the good work and keep on following the data. I mean, look to the leaders, which is obviously Public Health England and now perhaps New Zealand. And I think every country has to follow its own course, but you have to have a clear message that if you look at it realistically and objectively, the evidence is absolutely crystal clear that vaping is significantly safer than cigarette smoking. I even managed to get Stanton Glantz to say that he thinks that that's true. He thinks it's only maybe 25% safer, but even he says vaping is safer than cigarette smoking.
Do you think it's possible then that, vaping might find a permanent home and usage around the world?
I sincerely hope so, because it's crazy that at the moment we still have so many people dying and suffering death, and it's so many people suffering disease, disability, and death due to cigarette smoking. And what we've been doing for a long time isn't really working all that well. We've had nicotine replacement therapy, we've had varenicline, we've had bupropion for literally decades. And if those things were going to be effective at stopping people smoking, then we wouldn't have any smokers now. But clearly the fact that we still have people who have been through regular smoking cessation clinics and regular smoking cessation programs and are still smoking means that we have to do something different. I don't think the status quo is acceptable, and I don't think continuing to do the same thing that we've done for 20 years is a reasonable approach. So we have to look at something different. And vaping is very definitely something different, with a whole pile of data to show that it works and it's effective. And the people who are arguing against it are, in many cases, using blatant misinformation, which demonstrates how weak their case is, right? They can't actually make a real case that vaping is dangerous. So they make a fictitious case that vaping is dangerous. So one of the things that I come across lately, which I kind of like, is people who are against vaping say, we don't know the long-term risks of vaping. So my comeback to that is, we don't know the long-term risks of the COVID vaccines either. We know a heck of a lot more about the long-term response of the body to vaping than we do about the long-term response to the vaping of the body to the COVID vaccines. But in both cases, we know exactly what's in these products, and we have sufficient similarities between these products and previous products that we can predict pretty accurately exactly what's going to happen. And in both cases, the alternative is something that's going to kill literally millions of people. So you have to balance an absolute certain risk of millions of people dying with the very, very small possibility that maybe there is some risk in the COVID vaccine or there is some risk in vaping that we haven't noticed or we haven't worked out yet. But given in both cases the fact that millions of people have had the COVID vaccine without problems and millions of people are vaping without problems, we can be pretty sure that both the COVID vaccine and vaping are safe, and that they're effective ways to treat a condition which kills millions of people.